What can you do about painful myofascial trigger points? For the answer, stay tuned. The fascia, or myofascia, is also known as the connective tissue. It's what surrounds muscles and surrounds the individual parts of the muscles. It surrounds the organs and the bones, and it's like one interconnecting web or network through the entire body. Now, sometimes places in the body, if there's been trauma, for example, you may get kind of a stuckness where the different levels of the fascia, the connective tissue, get kind of melded together. Now, the student who wrote in had chronic pain for many years, and using her yoga practice and some other techniques, she's been able to greatly decrease her amount of pain. She still, though, has these painful spots, particularly in her arms, where if you push on them, they're very tender, and like nodules, she refers to them as. Okay, so the question is what you can do about that. Now, a lot of times in yoga, we talk about trying to stretch muscles, but often what we're really trying to do is stretch fascia, the connective tissue around the muscles, not the muscles themselves. Of course, when you stretch the fascia, then the muscle that's in between the layers of fascia can in fact also stretch. Okay, so we've got to find some way to open that up. Now, a normal yoga pose, you might come in and out of a pose or come in and hold it for 30 seconds. That may not be enough to really affect the connective tissue. You may need to have longer holds. So a practice like yin yoga, for example, where you passively hold poses for 3 minutes or 5 minutes, this may start to help break up some of the adhesions between the different levels of the fascia. Okay. Now, I have also found that a body work technique called myofascial release, and particularly I've done it in the style developed by a physical therapist named John Barnes. And this is a hands-on treatment, and they find by feeling where there are restrictions in fascial mobility. And what they do is they put a kind of gentle, constant pressure, and they may stay there for several minutes until the fascia starts to let go. And when it lets go, they can then follow the tactile trail to the next place in the body where the fascia is restricted. And with that process over time, they can open up tremendously. Now, in dealing with my cancer, I was quite worried about my head and neck had gotten radiation therapy, which can lead to stiffness and loss of range of motion and pain, etc. And so I did a bunch of myofascial release sessions to try to open up my neck. And in fact, I had huge results with that. I had better range of motion after my cancer treatments in my neck than before cancer treatments, because the myofascial release just got at some chronic old stuff, not just the scarring from the radiation, but also old kind of fascial adhesions that had limited me. And so they broke those up as well. Now, once you've had a bunch of myofascial release, and I've now had many dozens of MFR sessions, I've kind of learned how to do it on myself. And so you can do this in different ways. One is with various props like rollers and balls and other things. And you've got an area of myofascial restriction. You, for example, lie back over a soft ball, pushing right on the area where you've got the restriction. Hold that for several minutes and you can get a similar release. And you can sometimes, put one roller in one place in the body where there's restriction and a ball someplace else where there's restriction. You can potentially use multiple tools at the same time. That's something an MFR therapist could show you. So the idea is we're going to try to combine myofascial release, or techniques borrowed from myofascial release, with yoga. So we're going to do something like a supported shavasana, but we're going to use these various props to put sustained, gentle pressure on myofascial restrictions with the idea of opening them up. And when you do several simultaneously, you can get a deeper effect because the different areas of the fascia all are connected to each other. And when you release one, it can cause further release in far-flung areas of the body. So I'm going to use a foam roller, which I'm going to put under some tight spot in the back of my calves as I lie back in Shavasana. I've got a couple of these semi-domes that I'm going to put under the top part of my arms where I have some fascial restrictions. And I'm going to put the eye bag, as you'll see, underneath my neck. Okay, so let me then come back and I'm going to just take the roller and I'm going to find kind of a juicy spot where there's some tenderness in the calf muscles, keeping a slight bend in the knee. Then I'm lying back and I've positioned these half domes so that when I lie in Shavasana, they put pressure on an area where I have tightness in the fascia, kind of near the left and right triceps muscles, head of the triceps. And then I'm going to take the eye bag, and what I'm going to do, since I'm recovering from radiation therapy to my neck, I'm going to put it down, and this is a heavy weighted eye bag, and it's curved to allow it to fit under the neck. And I'm just going to leave it there the entire duration of Shavasana. Now this may not feel exactly like Shavasana because sometimes there's an ache or even at first sometimes a more intense discomfort with these props. But as your body opens up, they become more comfortable. And I would shoot for 3 to 5 minutes at least in each of these poses. And you can move the various props around and use different props or all kinds of balls and smaller rollers, and many tools have been invented for this purpose. But the idea is the same with them all. Gentle, sustained pressure for several minutes, allowing the fascia to open up. Now the other thing that I've started playing with now that I've had enough MFR sessions that I kind of realize what they're doing with their hands, I find sometimes I can hold a yoga pose. So for example, say I'm going to come in to Baddha Konasana, bound angle pose, sometimes known as cobbler's pose, where you've got your feet pushed together, knees out to the side, allowing the knees to gently drop down toward the floor, as far as is comfortable for you. Now, I will sometimes find an area in my calves or on the soles of my feet. And while I stay in that pose, again, 2 minutes, 3 minutes, 5 minutes. For example, I'll put one thumb on the plantar fascia of one foot, one thumb on the plantar fascia of the other foot, just in an area where it's kind of tender and where I could feel the fascia is kind of restricted, and put gentle pressure and just sustain it the whole time I'm in the pose. Regular old yoga can also help to some degree with opening up fascia, but it's a pretty slow process. And so the techniques I've mentioned are a way to potentially speed up that process a little more. Good luck to you. Thank you so much. Take good care. Namaste.